Today, people with disabilities often face significant oppression due to attitude formations that have been influenced by societal views. So what exactly causes people to have these attitudes and how can we change them? An attitude can be defined as a settled way of thinking or feeling about something. Attitudes are generally thought to be part of the socialization process and can be either negative or positive. Most commonly, people with disabilities are subject to negative attitudes. An attitude formation defines how our attitudes are created. There is modeling, which is broken down into three further components. Next, we have cognitive dissonance, which means there is a tendency for people to seek consistency amongst their beliefs and opinions. Then conditioning, which influences our attitudes towards an object, our personal beliefs, our experiences, and our culture. The media is the single most influential thing when forming our views and attitudes. The internet, newspapers, radio, and television often create a sense of discrimination, manipulation, and prejudice. A study established that the media created the following 10 stereotypes on disabilities: unable to participate in everyday life, non-sexual, super cripple, a burden, laughable, the worst enemy, sinister, an object of violence, pathetic, and an atmosphere rather than a person. Further to this, the social model and the medical model are another significant reason why this oppression occurs. The social model of disability believes that disabilities are a direct cause of the way that society is organized rather than seeing it as an impairment. The social model is important as it argues that people with disabilities should live equally and independently without the restricting barriers that they face. Contrary to this, the medical model of disabilities believes that people with disabilities have impairments and differences. The medical model is what creates oppression within society today, as it calls for the impairments and differences of people with disabilities to be fixed by medical treatments even when they do not cause any illness or pain to the patient. The ABC model is also another cause of the extreme societal views we have. Affective is the negative emotions and feelings we have. Behavioral is the experiences that negatively affect our attitudes, and cognitive is the beliefs and thoughts that we associate with disabilities. Oppression can be defined as unequal treatment towards someone. People with disabilities often face unemployment, unequal schooling, exclusion, stereotypes, and less independence due to the oppression. Removing the negative attitudes and stereotypes that people with disabilities are subject to, a community that promotes full equality and empowers all by working towards full community inclusion will be present. This will create opportunities for people with disabilities in all aspects of their life.
Created using Powtoon.